Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Dr. Hrkal, can you share your opinion on soy milk? I can't do almond milk or other nut milks and don't really use cow milk often as I know it isn't the best to consume a lot of it. I like to make my own fancy tea instead of going to Starbucks to try and cut down sugar. Would it be okay to use soy milk every afternoon for it? I know there's a mixed information about soy and hormones. I'm battling a bit of hormone imbalances as I'm starting perimenopause, but my tests weren't horrible.
Yeah, there's a lot of controversy about soy. I'm glad this question was asked. So soy milk, before the whole dairy alternative milk became so popular, soy milk was kind of the main milk that was available because there was a vegetarian option or vegan option that people were looking for. The big thing with soy, when you look at all the evidence in terms of its effect on hormones, a lot of it comes down to actually being positive in people over the long term. These are called longitudinal observational studies. There is a natural phytoestrogenic, phyto meaning plant, effect for some plants, and soy is the most well-known, but there's many other plants that have this phytoestrogenic effect, like, for example, sage is one that comes to mind. And if you look at these same ingredients or herbs or foods in a petri dish, it does show that they interact with estrogen receptors in similar ways to estrogen. It is a lot weaker than our real hormones in our body. But then there is if I have a hormonally sensitive condition like fibroids or breast cancer, is that making it worse? And it's the fear around that from an oncology perspective that a lot of people have translated into the human data. But the human data overall shows it actually is protective against cancer, which might sound like a shock to a lot of people. Soy has a lot of beneficial ingredients and components in it. These active constituents do have some anti-inflammatory effects, but there are a couple of key caveats. So the short answer to your question is yes, I think soy is okay to consume in small amounts as long as it's organic, which means it should be non-GMO, because the genetically modified version, I think in this case, is going to be detrimental. And also any sort of exposure to environmental contaminants like glyphosate is higher in non-organic versions. So I think if you're looking for unsweetened organic soy milk as part of adding it to a latte, like a matcha latte or a tea or coffee even, I think that's totally fine. And again, have a conversation with your health provider. There are a couple situations, like in thyroid issues or in cancer issues, active cancer issues, then maybe that might not be the best idea. So obviously, always talk to your healthcare provider about that.
Great. Another one here. I have a question about the vision. I'm walking every day now. When I walk at the beach or in the dunes, things go quite okay. When I walk in the forest, I get headaches quickly and my eyes get tired really quick. I do make jokes about there's too many leaves, too many branches, but I want to know what is happening and what exercise of the vision module can I do to improve this?
It could be a visual motion thing, right? If there's just a lot of motion in your peripheral visual fields, sometimes people can have an issue with that. Sometimes that is neck related, so you can try getting some neck treatment and seeing if that improves. You can also just try to continue to expose yourself to that, right? So sometimes just gradual exposure to that which affects you can improve that and make it less. Those would be my two answers on that. There could also be issues with like over focalizing your vision. Like a lot of time people that have these motion sensitivities tend to be very like focalized in their vision, meaning that they're fixated on what they're actually looking at and they're not allowing their gaze to expand and kind of pick up the periphery. And usually in a wide open environment, it's kind of easier to do that. But when you're in, walking a trail or something in the woods, you do kind of over focalize because you're worried about tripping over things and whatever. So it could just be something like that. Like try opening up your gaze a little bit wider, and just like relaxing your gaze rather than being, hyper focalized on stuff. So those would be kind of the three main things that I can think of.
Great. Here's one. A friend was recovering from concussion and went for an MRI appointment. She had the scan, which, and then following the scan, she relapsed and never really got to back to baseline. Why would this be?
Best bet, anxiety response. You're in a confined tube. It's loud, it's banging, there's noise going on. If you've ever been in an MRI, you're really squished in there. You don't have a lot of room to go. And that can be a high stress environment. Sometimes people are worried about what they might find. And so that can create a stress response. And so to me, there's nothing the MRI would do to affect your brain or anything like that, but it's your response to it, right? It's the same idea. Like somebody was asking about, cranial sacral therapy that really flared up. It could be just the response to that, right? If you're feeling anxious and comfortable, and then you come out and you start thinking, oh, maybe this MRI did something to me. Well, now you start spiraling out of control on that. And then the stress of that just compounds and compounds. And now you're in this completely dysregulated state. So best bet is an anxiety response.
Okay. And maybe the last one here. I'm on the 6th day of taking CBD only. So this is actually from our live last week, where we had talked about CBD and things like that. So person's following up. I'm on the 6th day of taking CBD, only 25 milligrams at 8 a.m., trying to reduce my use of ibuprofen. I talked to you last week on the call. I felt nauseous and very tired. Thought I might be getting sick, slept 2 hours. On the 7th day, it was the same. Day 8, I cut my gummy in half with the same results. While writing this, I realized I must experiment more, maybe a break of a few days and start again with half. I guess my only question now is, wouldn't that nausea normally happen in the first few days and not the 6th? P.S. CBD has helped. I cut the use of my ibuprofen by 2/3.
I mean, the sixth day after starting something, it sometimes takes a kind of a building effect to happen. This happens with medications often enough. Uh, it also could be totally unrelated. It's not really clear just from the information that was put here. The fact that it's helping you, I think, is a good sign. And I think you're onto something by saying that you need to kind of experiment more to figure out, okay, does that still happen if you reduce the dose in half and continue it for a week? Is it, does it still have the same effect if I use it every other day? So there's a number of other things I'd suggest before I would just pin it all on, the CBD piece.
Paul, what about the time of day? First thing in the morning can be a really sensitive time for a lot of people to take, a
Yeah,
supplement.
you could try it before bed, Melinda. That's a good point. That could be another way to offset that nausea. Some people do get nauseous. But again, also the symptom of nausea with CBD is not common in my experience. Usually people will take it for nausea. Now, mind you, there's a bit of a THC component to that too, which is helpful. So that's not really a common thing. And again, is this happening all the time? Or is this happening just doing it once and it happening on the 6th day, to me, is not enough to say this is causation.
What about the other ingredients in a gummy versus
Yeah, but if that was the case, that wouldn't have as much of an additive effect. That probably would have like an immediate effect if it was like some sort of preservative or some other non-medicinal ingredient. Usually people would have an immediate like GI effect to that, or even like a non-GI effect. Like let's say a headache because you had polysorbate in it, for example. That's probably not high on my list, but just a thought nevertheless.
Yeah, I mean, it sounds like it needs more time. I mean, a couple
Yeah.
weeks, right? What if there was just a bug this week? It's winter. Well, here it's winter
Yeah.
anyways.
There's a
You might
ton of
just have,
there's a ton of norovirus going on right now, so
right?
it's huge.
Yeah.
Yeah, it could be coincidence.
And it's also presenting with really peculiar symptoms where it's like people get rashes and hives, and it's kind of like you feel this off and on like nausea every couple days. My kids have kind of been going through it for the last month, where they're good for 2 days and then they're like Daddy, my stomach's hurting, it's off. And they're like, well, did you eat something? Did you overdo some junk food, or, which they rarely ever eat? But, this is the presentation. And then they get some weird skin things. I've seen that. So maybe be a bit more patient there with it, and curious about it, using Melinda's word.
Curious, perhaps, maybe. These are powerful.
We all have our little
powerful
mantras.
If anyone wants to know more, we did our The Power of Maybe live, right?
Yeah, that's a good.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.